Hi, Dr. Eric Thomas for Nutmeg Dermatology, talking today about one of the earliest signs of sun damage, and not the earliest. That could be more cosmetic, and I want to talk about that as a separate individual thing. But let's talk about actinic keratoses. You might hear them called solar keratoses. These are usually on the face, though they could certainly be, especially later, on the hands. It's interesting that in the United States, I see far more of them on the left side of the face and the hand, and over the years I've been fascinated by finding two people who worked for the post office and delivered rural routes who had vehicles that were open on the right side, and they were the reverse. They seemed to have more on the right side. Then I had two boaters. We have a lot of boating up here in Connecticut by Long Island Sound and the Connecticut River, and apparently power boaters tend to be to starboard, and they were again more on the right. And then I had a lady come in who lived in Africa and we got talking, who knows how, and she said that the people in Africa, the whites, the blacks can get it too, but certainly the lighter the skin, we'll get to that in a minute, the more likely would have more on the right side because they drove on what we, air quotes, consider the wrong side, the British side of the road, namely on the right side. So in any event, how do you find them? Well, first of all, they can be rather subtle. Sometimes in examining a person's face, I'll use the wooded end of a Q-tip gently just to see if I can find a little roughness. And yes, they are a little rough. They might be a little bit red. But the interesting thing is that when I do find it, people will react with a bit of a ow, much more than you would think. It's just a little raised, so they are sensitive. They can sometimes itch a bit also, and we sometimes treat them, especially on the back, because of itching. So there you are, you're here, you have 4 or 5 or 10 or 20 little rough, scaly spots. What happens if you don't treat them? Sorry to tell you, but if you live long enough, I hope we all do, if you live long enough, they will all turn into squamous cell carcinomas, cancers, which are the second most common type of cancer in the United States. So they really should be treated. Maybe not an emergency, but they're also a little uncomfortable usually. How do we treat them? Well, we have, again, a fork in the road. I love forks in the road. It helps my simple mind document things and have a roadmap. So one side is a spot treatment, and the other is a field treatment. So for spot treating, we frequently will take liquid nitrogen, which is not what they sell in stores for 25 bucks. Liquid nitrogen is minus 200 centigrade. Somebody once corrected me to minus 199.5, and it's kind of difficult to get down that far without true liquid nitrogen or similar cryogens. Problem with those cryogens, those cold things, are that they can't be kept around in a little spray can. The spray can has to be filled every day, and liquid nitrogen's pretty expensive stuff, let me tell you. Therefore, might want to save your money when it comes to little spray cans. Uses the same technology doctors use. Yeah, that's true, but a lot of things use the same technology, but are very different as far as the temperature they achieve. Anyway, enough of the spot treatment. Then we get to field treatment. What's the difference? Well, as it indicates from the word, the field allows you to treat a whole area, the whole face in one fell swoop. And we have two ways of doing that. One way is with a natural chemical, which is aminolevulic acid, and natural light, and that's photodynamic therapy, and I have a separate little talk about that. The other way is a slightly older technique that uses various creams. The most common one is 5-fluorouracil, though there are others. imiquimod, and so forth. 5-fluorouracil is very interesting. I believe that it was the first one that was used because it actually is an anti-cancer cream. Anti-cancer treatment. And people who are being given infusions or injections for various blood cancers noted that parts of their face would light up and would become red, and then the rough spots would go away. Well, fast forward, let's make it into a cream. It isn't absorbed quite as much, and so forth. The problem with these creams is that unfortunately they used to be fairly inexpensive. Go figure, they suddenly became $700–800 for a small tube. What can I tell you? Check with your pharmacy before you get it filled. And in addition, they have to be applied, some for only a few days. Those are the newer ones like Piccata, but the traditional ones have to be applied for 3 or 4 weeks and produce severe redness and irritation. Most people who have used 5-fluorouracil or similar, really, if they know there's an option, prefer to avoid it. I will say there are some places, such as the back, where the irritation doesn't show, maybe the chest, maybe the arms during the winter, when it doesn't make any difference as far as cosmetics go, where the creams do make sense. But regardless of which way you treat them, actinic keratoses shouldn't be there. We should try to get rid of them, and we can. So, you take your car, whatever, to the mechanic, you change the oil, you do maintenance. What we're talking about is doing maintenance on presumably, the most valuable possession you have, your body. So take care of it and let us help take care of it. That's our job, just as you wouldn't try to change your engine yourself, you wouldn't try to perhaps repair your own car's transmission. I don't think you're really up to doing some of the things we can help you with. At least come in, find out if you do have a problem. Anyway, we're here to help you. It's nice to see you. Thanks for listening. This is Dr. Eric Thomas for Nutmeg Dermatology. Bye-bye.